Hi. You've very clearly made the point that the problem is not so much coverage as it is cost. And you've demonstrated how some places like Mayo Clinic and the Intermountain Health are able to provide high quality at lower cost. But that's not true, unfortunately, throughout most of our country. And so how then do you incent providers to provide quality care knowing that they're going to make less money doing that because they're going to have healthier patients, they won't be keeping people in the hospital as long, they'll be doing fewer procedures, so they make less money? What's the incentive for the medical providers for doing that?
Well, you've made my point. You've made my point that the profit motive is what's driving behavior in our system today. And I'll make the point back to you that a large number of doctors and nurses are not happy about it. In the book, I talk about the discovery of the drug penicillin, which occurred almost 100 years ago now. It was a serendipitous discovery by a doctor who was trying to do bacteriology in his lab across the street from a pub in London, and a colony of mold invaded his plate, his bacteriology plate, and killed off a bunch of bacteria, and he realized that was an important discovery. Now, he didn't end up figuring out how to mass produce penicillin, and it took another decade for that to happen, which happened, by the way, by government spending, not by private investment. That doctor never thought of himself as someone who should be cashing in on that, really. That's probably the discovery of the last 1,000 years. He never thought of himself as someone who should be financially enriched by that. And most doctors, over the course of the history of medicine, would fall into that category. Yeah, they should be paid well. They expect to be paid well. Higher levels of income. It's a hard job. It's hard training. But most of them didn't go into it solely because they thought they were going to be made wealthy. In fact, if that's what they were really about, if a young person was really about that, they'd go to law school or get a CPA or something. I don't know. I didn't do that, obviously. In fact, this is another story from the book, from my family. Caitlin's older brother, who, when he was 4, was asked by somebody, "What do your parents do?" My wife is an attorney. She's a corporate bankruptcy attorney. And his answer was, "My mom is a lawyer. She works for money. My dad is a doctor. He takes care of sick people." That's a distinction I think almost everybody understands. Altruism is a bigger motivation than people in the market economy give it credit for. And that is what I'm depending on. I'm basically saying if you give doctors and nurses a chance, they will do the right thing. Most of them will do the right thing. And the ones that don't want to do the right thing, they just want to make money, well, we need to drive them out of this business anyway.
Could the cost of medical school be driving
Yes.
that bad behavior in any way?
Yes, I agree that that's the case. I graduated with $100,000 in debt, and that certainly drove behavior, although I still chose to be a public health doctor, which I guarantee you doesn't make a lot of money. But yes, it's true, and we need to do something about it. I believe doctors need to, and nurses too, need to recognize they have their skills because there's been a bunch of patients who have taught them, given them a chance. The first time I drew blood from a patient, I didn't know what I was doing. That poor guy, I must have stuck him 6 times. But he was patient and he let me learn, and I owe him. I owe him big time. I think in exchange that doctors ought to recognize that they are getting a gift when they go through their training, nurses too, and other health professionals. And yes, part of that gift ought to be, the cost ought to be manageable, so that afterwards they're more interested in taking care of people and doing the right thing, and all of the various things that we consider medical ethics.
Yeah. All right, thank you.
Mm-hmm.